Question 1. How many characters can a complete and valid ICD 10-cm code have? A. 3 to 5 characters. B. 3 to 7 characters. C. Exactly 5 characters. D. Up to 6 characters. Answer: B. 3 to 7 characters. This question tests your understanding of the basic structure of an ICD 10-cm code. While some codes are only 3 characters, representing a category, a complete code typically includes a decimal point after the third character and additional characters for specificity, with some codes requiring a 7th character for things like episode of care for injuries. The minimum length for a code to be valid at the category level is 3, but full specificity can extend up to 7 characters, never less than 3 for a category or less than 4 for a subcategory. For example, A01 represents typhoid and paratyphoid fevers, 3 characters, while A01.0 is typhoid fever, 4 characters, and S82.131A is a gustilo open fracture of right medial tibial condyle, initial encounter for closed fracture, 7 characters. Remember, codes need to be coded to the highest level of specificity, which often means using more than 3 characters, and potentially up to 7. Question 2. When coding a confirmed diagnosis, what is the general rule regarding coding signs and symptoms associated with that diagnosis? A. Code both the diagnosis and all associated signs and symptoms. B. Only code the signs and symptoms, not the confirmed diagnosis. C. Do not code signs and symptoms that are an integral part of the confirmed diagnosis. D. Code the signs and symptoms as the primary diagnosis and the confirmed diagnosis secondarily. Answer: C. Do not code signs and symptoms that are an integral part of the confirmed diagnosis. This question focuses on a fundamental ICD 10-cm guideline regarding coding when a definitive diagnosis is known. If the signs and symptoms are typically associated with and included within the description of the confirmed diagnosis, you generally only code the diagnosis itself because the symptoms are considered inherent to the condition. Coding the signs and symptoms separately in this instance would be redundant and potentially misleading. For instance, if a patient is diagnosed with pneumonia and presents with fever and cough, typical symptoms of pneumonia, you would only code for the pneumonia, not the fever and cough separately. The key takeaway is that when a definitive diagnosis is made, associated symptoms that are part of the condition are not coded additionally. Question 3. The convention excludes 1 in ICD 10-cm means: A. The conditions listed after it are included in the code's description. B. The code cannot be used at the same time as the code or codes listed after the excludes 1 note. C. The conditions listed after it are not included here, but the patient could have both conditions at the same time. D. The code is only for use as a primary diagnosis. Answer: B. The code cannot be used at the same time as the code or codes listed after the excludes 1 note. Understanding the excludes 1 note is crucial for accurate coding, as this question addresses. An excludes 1 note indicates that the condition listed after it is mutually exclusive with the code above the note, meaning the 2 conditions cannot occur together in the same patient at the same time. Therefore, you would never use both codes on the same claim for the same encounter. For example, if a code for a specific infection has an excludes 1 note for another condition, it means a patient cannot have both that specific infection and the excluded condition simultaneously. Always pay close attention to excludes 1 notes to avoid coding errors. Question 4. Which of the following is the placeholder character used in ICD 10-cm? A. 0. B. Z. C. X. D. 9. Answer C. X. This question tests your knowledge of a specific convention used in ICD-10-CM codes that require a seventh character. The placeholder character X is used to fill in empty character positions when a code has fewer than 6 characters but requires a seventh character extension. This ensures the seventh character is in the correct position, which is the seventh position. For example, if a 5-character code needs a 7th character, you would use X in the 6th position to push the required 7th character to the 7th spot. Remember, the X ensures proper code structure when a 7th character is needed, but the code isn't naturally 6 characters long before the extension. Question 5. A patient is seen for a follow-up visit after completing treatment for a fractured tibia. The fracture is healing normally. Which 7th character would typically be used for this encounter? A. Initial encounter. B. D. Subsequent encounter. C. S. Sequela. D. P. New injury. Answer B. D. Subsequent encounter. This question assesses your understanding of 7th character use for injuries, specifically related to the episode of care. The 7th character D is used for subsequent encounters for injuries, which includes routine follow-up visits during the healing phase, cast changes, or removal of external fixators when the patient is receiving routine care for the injury during the period of healing and recovery. Since the patient is having a follow-up visit for a healing fracture after initial treatment, D is the appropriate choice. Think of A for the very first time the patient is seen for the injury, active treatment, D for visits during healing, and S for complications that arise after the acute phase has ended. Question 6. According to the ICD-10-CM guidelines, when should a sign or symptom code be used as the primary diagnosis? A. Only when a definitive diagnosis has been established. B. When the physician has documented a definitive diagnosis. C. When no more specific diagnosis can be made after investigation. D. Never. Signs and symptoms are always coded secondarily. Answer C. When no more specific diagnosis can be made after investigation. This question highlights a key guideline about when it is appropriate to code signs and symptoms. Sign and symptom codes are acceptable and should be used as the primary diagnosis when the physician has not been able to determine a more specific diagnosis after a thorough investigation, or when the signs and symptoms are being treated specifically without a definitive underlying condition being identified. For instance, if a patient presents with persistent cough and extensive tests do not reveal a specific cause like pneumonia or bronchitis, the code for cough might be used as the primary diagnosis. The takeaway is that signs and symptom codes are appropriate when uncertainty about the definitive diagnosis remains after evaluation. Question 7. A patient has documented type 2 diabetes mellitus with diabetic nephropathy. How would this be coded in ICD-10-CM? A. Code for type 2 diabetes only. B. Code for diabetic nephropathy only. C. Code for type 2 diabetes and code for diabetic nephropathy, sequencing the diabetes code first. D. Code for diabetic nephropathy and code for type 2 diabetes, sequencing the nephropathy code first. Answer C. Code for type 2 diabetes and code for diabetic nephropathy, sequencing the diabetes code first. This question tests your knowledge of combination codes and sequencing rules, particularly for conditions like diabetes with complications. In ICD-10-CM, there's a general guideline that instructs coders to assume a cause and effect relationship between diabetes and many associated conditions, like nephropathy, unless the documentation states otherwise. Therefore, you code both the underlying condition, diabetes, and the manifestation, nephropathy. The guideline specifies that the diabetes code is typically sequenced first, followed by the code for the manifestation. For example, you would use an E11 code for type 2 diabetes followed by an N08 code for glomerulonephropathy in diseases classified elsewhere. Always check the tabular list and the guidelines for specific instructions on coding diabetes with manifestations. Question 8. What is the primary use of the ICD-10-CM code set? A. To classify surgical procedures. B. To classify medical diagnoses and reasons for visits. C. To report healthcare services and procedures. D. To track patient demographics. Answer: B. To classify medical diagnoses and reasons for visits. This question asks about the fundamental purpose of the ICD-10-CM code set. ICD-10-CM, which stands for International Classification of Diseases, 10th revision, clinical modification, is the standard system used in the United States to classify diagnoses, symptoms, and reasons for encounters. These codes are used for various purposes, including mortality and morbidity statistics, research, and crucially, on healthcare claims to justify the medical necessity of services provided. Procedure coding systems like CPT and HCPCS Level 2 are used for reporting services, while ICD-10-CM is specifically for the diagnoses. Question 9. A physician documents possible pneumonia. How should this be coded in an outpatient setting? A. Code the definitive diagnosis of pneumonia. B. Code the signs and symptoms leading to the suspicion of pneumonia. C. Code possible pneumonia using a specific code for uncertain diagnoses. D. Do not code anything until the diagnosis is confirmed. Answer: B. Code the signs and symptoms leading to the suspicion of pneumonia. This question addresses a crucial guideline for outpatient coding when the diagnosis is uncertain. In the outpatient setting, you should not code diagnoses that are documented as possible, probable, suspected, likely, or similar terms indicating uncertainty. Instead, you code the signs, symptoms, or conditions that led the physician to suspect the diagnosis. For example, if the patient presented with cough, fever, and shortness of breath, you would code for those symptoms rather than coding for possible pneumonia. This guideline differs significantly from inpatient coding rules, so it's important to remember for outpatient encounters. Question 10. What does the term NEC stand for in ICD-10-CM? A. Not easily classified. B. Not elsewhere classifiable. C. New or extended code. D. No established criteria. Answer: B. Not elsewhere classifiable. Understanding the conventions like NEC is essential for proper ICD-10-CM coding. NEC stands for Not Elsewhere Classifiable and is used in the tabular list when the documentation provides a specific diagnosis, but there is no code available that specifically describes that diagnosis. This means the provider's documentation is more specific than the available codes allow. You would use an NEC code when you have detailed information that doesn't fit neatly into a more specific code category. Question 11. A patient is diagnosed with acute and chronic bronchitis. How should this be coded? A. Code only the acute bronchitis. B. Code only the chronic bronchitis. C. Code both acute and chronic bronchitis. D. Use a combination code for acute and chronic bronchitis, if available. Answer: C. Code both acute and chronic bronchitis. This question tests the guideline regarding coding both acute and chronic forms of the same condition. If the medical record documentation states that a condition is both acute and chronic, and ICD-10-CM provides separate codes for each, you should code both the acute and chronic forms. There are specific combination codes for some conditions, like acute on chronic bronchitis, but in the absence of such a specific combination code, you would list both codes separately. For example, you would code for acute bronchitis, J20, and chronic bronchitis, J42, when both are documented and no combination code exists. Question 12. What do the square brackets in the ICD-10-CM tabular list enclose? A. Synonyms, alternative phrases, or explanatory notes. B. Codes that are not included in the category. C. Mandatory fifth or sixth characters. D. Manifestations that should be coded second. Answer: A. Synonyms, alternative phrases, or explanatory notes. Understanding the formatting conventions in the tabular list is key to accurate code selection, and this question focuses on the use of square brackets. Square brackets in the tabular list are used to enclose synonyms, alternative wording, or explanatory phrases that provide additional information but do not affect the code selection. These terms are essentially equivalent to the term preceding the bracket. For example, a code might have a description like influenza, flu, indicating that flu is a synonym for influenza for coding purposes. Question 13. Which of the following scenarios requires the use of an external cause code, V00Y99? A. A patient admitted with pneumonia. B. A patient with a broken arm from a fall. C. A patient receiving chemotherapy for cancer. D. A patient with uncontrolled hypertension. Answer: B. A patient with a broken arm from a fall. This question tests your understanding of when external cause codes are appropriate. External cause codes are used to describe the circumstances surrounding an injury or other health condition, indicating how the injury or condition occurred, the cause, the intent, e.g., accidental, intentional, the place where the event occurred, and the activity of the person at the time of the event. Injuries are the primary condition that warrants an external cause code to provide detail on the event that caused the injury. Conditions like pneumonia, cancer, or hypertension do not typically involve an external cause in the same way an injury from a fall does. Question 14. When coding a condition documented as left arm fracture, which coding concept is most important to consider for specificity? A. Episode of care. B. Laterality. C. Type of fracture. D. Activity at time of injury. Answer: B. Laterality. This question highlights the importance of laterality in ICD-10-CM coding. For many conditions, especially musculoskeletal conditions and injuries, ICD-10-CM codes provide options to specify whether the condition affects the left side, right side, or is bilateral. Documentation indicating left arm fracture requires you to select the code that specifically identifies the left side to achieve the highest level of specificity, which is a core principle of ICD-10-CM coding. Failing to specify laterality when documented would result in an inaccurate code. Question 15. What does the excludes to convention signify in ICD-10-CM? A. The condition is included in the code above. B. The condition is mutually exclusive and cannot occur with the code above. C. The condition is not included in the code above, but a patient could have both conditions at the same time. D. The code is only for secondary diagnoses. Answer: C. The condition is not included in the code above, but a patient could have both conditions at the same time. Understanding the difference between excludes 1 and excludes 2 is vital for accurate coding. An excludes 2 note indicates that the condition listed after it is not included in the code above the note. However, unlike excludes 1, it is acceptable to code both the code with the excludes 2 note and the excluded condition simultaneously if the documentation supports both diagnoses. Think of excludes 2 as not included here, but code it separately if present. For example, a code for a specific type of arthritis might have an excludes 2 note for another musculoskeletal condition. If the patient has both, you would code both separately. Question 16. A patient is admitted with sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. How should this be sequenced according to ICD-10-CM guidelines? A. Sepsis code first, followed by the code for MRSA. B. MRSA code first, followed by the sepsis code. C. A combination code for sepsis due to MRSA, if available, otherwise sequence sepsis first. D. Code only the sepsis, as MRSA is the causative organism. Answer: C. A combination code for sepsis due to MRSA, if available, otherwise sequence sepsis first. Coding infections and their causative organisms correctly is a common task. When sepsis is documented due to a specific organism, ICD-10-CM guidelines generally require coding the underlying systemic infection, sepsis, first, followed by the code for the organism. However, ICD-10-CM does provide combination codes for certain infections and causative organisms, and if a specific combination code exists, like for sepsis due to MRSA, that combination code is used and sequenced first. If a combination code doesn't exist, you would sequence the sepsis code first, followed by the organism code. Question 17. What is the purpose of the instructional note code first in the ICD-10-CM tabular list? A. It indicates a manifestation that should be coded second. B. It indicates a code that should be used as the primary diagnosis. C. It requires the underlying condition to be sequenced before the code with the code first note. D. It requires this code to be sequenced before any other code. Answer: C. It requires the underlying condition to be sequenced before the code with the code first note. The code first instructional note is a sequencing rule found in the tabular list. When you see a code first note under a code, it means that the code you are considering cannot be the primary diagnosis if there is an underlying condition that caused it. The underlying condition must be coded and sequenced first, followed by the code with the code first note, which represents a manifestation or complication of the underlying condition. For example, a code for a neurological complication might have a code first note for the underlying disease that caused the complication. Question 18. A patient is diagnosed with a malignant neoplasm of the lung. Which code category would you primarily look in to find the correct ICD-10-CM code? A. Chapter 1, Certain Infectious and Parasitic Diseases. B. Chapter 2, Neoplasms. C. Chapter 10, Diseases of the Respiratory System. D. Chapter 18, Symptoms, Signs, and Abnormal Clinical and Laboratory Findings, not elsewhere classified. Answer: B. Chapter 2, Neoplasms. Understanding the chapter structure of ICD-10-CM is fundamental for locating codes, and this question tests that knowledge for neoplasms. Malignant neoplasms are classified primarily in Chapter 2 of ICD-10-CM, code C00D49. While the lung is part of the respiratory system, Chapter 10, the principal classification for cancerous growths is found in the neoplasm chapter, which provides specific codes based on the site and behavior, malignant, benign, etc., of the tumor. Always start with Chapter 2 when coding malignant neoplasms, using Chapter 10 or other chapters for related respiratory conditions if applicable. Question 19. What does the convention NOS stand for in ICD-10-CM? A. New or specific. B. Not otherwise specified. C. No other symptoms. D. Normally occurring syndrome. Answer: B. Not otherwise specified. NOS stands for Not Otherwise Specified and is another crucial convention to understand in ICD-10-CM coding. A NOS code is used when the medical record documentation is not specific enough to assign a more detailed code within a category. It indicates that the information available does not permit a more precise classification. Using a NOS code means you lack specific details that would allow you to choose a more granular code option within the same category. For example, if the documentation just says gastritis without specifying the type, you might use a NOS code for gastritis if more specific codes are available but the documentation doesn't support them. Question 20. A patient presents to the emergency department after being bitten by a dog. What type of code would be used to identify the cause of the injury? A. A procedure code, e.g., CPT. B. An external cause code, V00Y99. C. A status code, Z code. D. A complication code. Answer: B. An external cause code, V00Y99. This question reinforces the application of external cause codes, particularly in the context of injuries. An injury resulting from an external event, such as an animal bite, requires an external cause code from Chapter 20, V00Y99, to describe how the injury occurred. This code provides valuable information about the circumstances of the event, which is important for injury surveillance and prevention. While you would also code the injury itself, e.g., a code for the bite wound, the external cause code specifies that a dog bite was the reason for the injury. Question 21. According to general coding guidelines, what is the impact of a physician's documentation of a diagnosis that is not confirmed by diagnostic tests? A. The diagnosis should not be coded until confirmed by tests. B. In the inpatient setting, the diagnosis can be coded if it meets the definition of a reportable diagnosis. C. In the outpatient setting, the diagnosis can be coded if the physician documents it. D. Diagnostic test results must always be present to code a diagnosis. Answer: B. In the inpatient setting, the diagnosis can be coded if it meets the definition of a reportable diagnosis. This question highlights a significant difference in coding guidelines between inpatient and outpatient settings regarding uncertain diagnoses. In the inpatient hospital setting, if a diagnosis is documented as probable, suspected, likely, etc., the condition is coded as if it existed if it meets the criteria for a reportable diagnosis based on inpatient guidelines. This is because inpatient care often involves extensive investigation to confirm or rule out conditions. In contrast, outpatient coding requires a confirmed diagnosis, or the coding of signs/symptoms if uncertain. Question 22. What information is typically found in the ICD-10-CM alphabetic index? A. The complete codes with full descriptions. B. A list of diagnostic procedures. C. Main terms, subterms, and cross-references to the tabular list. D. Guidelines for sequencing codes. Answer: C. Main terms, subterms, and cross-references to the tabular list. The alphabetic index is one of the two main parts of the ICD-10-CM code set, and this question asks about its content. The alphabetic index serves as an alphabetical list of terms that allows coders to locate the most appropriate code from the tabular list. It contains main terms, usually conditions, diseases, or injuries, subterms that modify the main term with additional details, like site or type, and cross-references, like C and C also, that direct the coder to other relevant entries. The index does not contain the complete codes or guidelines, which are found in the tabular list and official guidelines. Question 23. A patient has hypertension and chronic kidney disease stage 3. According to ICD-10-CM guidelines, how should these conditions be coded and sequenced? A. Code hypertension first, then chronic kidney disease. B. Code chronic kidney disease first, then hypertension. C. Use a combination code for hypertension with chronic kidney disease, if available. D. Code only the chronic kidney disease, as it is a more severe condition. Answer: C. Use a combination code for hypertension with chronic kidney disease, if available. This question addresses the coding of hypertension with related conditions, specifically chronic kidney disease. ICD-10-CM assumes a relationship between hypertension and chronic kidney disease unless the medical record states otherwise. Therefore, the guideline is to use a combination code that includes both hypertension and the appropriate stage of chronic kidney disease, if such a combination code exists in the tabular list. If a combination code is used, it is sequenced first, followed by any additional codes needed for further specificity. Using a combination code accurately reflects the linked nature of these two conditions. Question 24. When coding a burn, what is the importance of documentation regarding the total body surface area, TBSA, affected? A. TBSA documentation is only needed for first-degree burns. B. TBSA is only used for inpatient coding. C. TBSA is a required factor for coding burns in specific categories, especially for third-degree burns. D. TBSA documentation is not used in ICD-10-CM coding. Answer: C. TBSA is a required factor for coding burns in specific categories, especially for third-degree burns. Coding burns accurately in ICD-10-CM requires detailed documentation, and this question highlights the significance of total body surface area, TBSA. For certain burn codes, particularly those involving third-degree burns, ICD-10-CM requires additional codes from category T31 to specify the extent of the burn based on the percentage of TBSA affected. This detail is crucial for assessing the severity and planning treatment for burn patients. Without TBSA documentation, you cannot fully code the burn according to the required specificity for these categories. Question 25. What does the instructional note includes mean in the ICD-10-CM tabular list? A. The terms listed are synonyms for the code above. B. The terms listed are conditions that are included within the code or category. C. The code excludes the conditions listed. D. The code requires a seventh character. Answer: B. The terms listed are conditions that are included within the code or category. Understanding the includes note is essential for proper code selection within the tabular list. An includes note appears under a code or category and lists conditions that are included within the scope of that code or category. These are examples of diagnoses that would be classified under that specific code. For instance, a category for a type of disease might have an includes note listing several specific conditions that fall under that broader category. The presence of an includes note helps clarify the content of a code and ensures you are using it for the correct diagnoses.